Guys, so first of all I wanted to thank everybody who signed and shared my petition from the last video that I posted. I really truly appreciate it, and I'm blown away by the response that I've gotten. I had no idea that so many people that I don't even know would sign, much less leave some of the lovely comments that were on the petition. So again, thank you so much if you watched it or shared it or left a comment, whatever. I really appreciate it. I wanted to make this update video because today was my appointment and I wanted to update you guys on how it went and what I said. So I wrote out everything that I wanted to say so that I wouldn't forget anything and that I could explain everything clearly without leaving anything out. And I'm going to read you what I wrote to tell the doctor. I printed it out and took it with me, and I also printed all of the comments that you guys left and left the speech and the comments with him to read over, but I read over the speech while I was there. So like I said, this is going to be an update and I guess what I said to the doctor and what is going to be happening moving forward with the situation. So if you're interested, then you can keep watching. If not, then you can go ahead and click out of this video. I promise it won't hurt my feelings. I just wanted to make an update for the people who are keeping up with this and who wanted to know how it went, and yeah. So, that being said, I'm gonna read. I have it all on my phone. It's kind of long, but I'm going to try and talk somewhat fast so that this video isn't too long. Also, side note, I'm outside in my car because everybody in my house is asleep and I didn't want them to wake up and I didn't want to have to talk super quiet. Plus, there's a lot better natural lighting outside anyways. Alright, I started out by saying, let me tell you about my constant struggle with severe endometriosis. I've had 2 surgeries to remove endometrial tissue that was outside of my uterus and then burning the area, surgeries that had me bedridden for almost a week after, where I wasn't allowed to lift anything heavy, including my 7-pound dog, for 6 weeks. I've been on 3 different birth control pills, all of which made me so nauseous that I couldn't even eat, 1 birth control patch that did nothing to help anything, and a birth control shot that put me in early menopause, where I was not allowed to take hormones to counteract the symptoms, some of which I still suffer from almost a year after being off of that shot, that include hot flashes, night sweats, bone density loss and bone pain, decreased memory, extreme fatigue, extreme mood swings, extremely dry skin, hair loss and hair thinning, and severe headaches, and I still dealt with random abdominal pains. I've been to 2 different doctors in the last few years, and both refused to do the only surgery that is the cure for endometriosis, which is a complete hysterectomy. It is a fact that this is the only cure, and women who have it are constantly told it's just something you have to live with. Let me tell you another fact. People with endometriosis often have a hard time getting pregnant, and yet my last doctor uses that as an excuse to not have the surgery, because I might want to have children of my own one day. And God forbid I, as a woman, am unable to have my own children due to my own choice and wishes. Doctors act like my life as a woman would significantly decrease in value and quality if I were unable to carry my own children. Why do you think they think that? Because they view women as whether we are in the childbearing years or not, and if we are, that it is our duty to have kids. That having kids is all we're good for. You may think you don't think that way, but give me another reason why I would not be able to decide for myself what I want. In an article copyrighted March 2015 by the American College of Obstetricians and Gynecologists, hysterectomies are one of the safest surgical procedures. According to the Office on Women's Health, U.S. Department of Health and Human Services website, each year in the United States, nearly 500,000 women get hysterectomies. A hysterectomy is the 2nd most common surgery among women in the United States, the most common surgery being childbirth by C-section. Also on their website it says the following about hysterectomies. For most women, the biggest change is a better quality of life. You should have relief from the symptoms that made the surgery necessary. So they are a well-known procedure. It would not threaten my life any more than any other surgery I would have. So it's not for my benefit that they refuse to do it. He says, what if you change your mind? It's a permanent surgery to a temporary problem. First of all, endometriosis is not a temporary problem. It is something that affects my daily life, even when I'm not on my period. I get random severe pains because, side note, I know you're a doctor, so you know this, but let me reiterate it for you. When you have endometriosis, your endometrial tissue finds itself outside of your uterus. The endometrial tissue is what bleeds and sheds when you have a period, meaning that tissue sheds and bleeds no matter where it is in your body. I'm basically bleeding internally at random times, and it's nothing anybody can predict or stop unless I have the surgery to remove my uterus and ovaries. I will not change my mind because I've wanted to adopt my kids since I was 6 years old, and my mom can back that up. I am also asexual, which means I would never want to conceive children naturally anyway. Secondly, people have cosmetic and other elective surgeries all the time because they sign a release stating that they know it's permanent and sometimes irreversible. And yet I, someone who deals with constant pain, am denied a surgery that would drastically improve my quality of life. Another excuse often used is that I'm not old enough to know what I want. Correct me if I'm wrong, but at 18 years old, I'm old enough to vote, which directly affects everybody in this country and other countries. Also, when I turn 18 years old, I am then the sole responsible party when it comes to any insurance issues, anything to do with my medical care. My mom can't make legal decisions for me anymore. I am legally old enough to make decisions for myself. So I am 19 years old, but I'm not old enough to decide what I want to do with my own body when it is the only cure for a chronic, extremely painful illness that directly affects me and only me, that is a safe procedure and would greatly increase my quality of life. I have been through early menopause, as I said earlier. I know what to expect when it comes to that. However, because I still had everything when I was on the shot, I was not allowed to take hormone replacements because they would negate the shot, in my doctor's words. After a hysterectomy, I would be allowed to take hormone replacements to help with the menopause symptoms, so in reality, it would be easier on me than being on that shot that I was on for 6 months. Another issue that I find confusing and contradictory is that many transgender people get surgery to remove everything, even body parts, at very young ages all the time. While I support people who feel the need to do that, to feel more like themselves on the outside and inside, I am also confused because it is a surgery that would drastically improve my life by helping me to not be in constant pain and constant discomfort, and I'm not taken seriously because of my age and because they think I wouldn't be happy if I couldn't have children of my own. For a doctor to assume that they know more about my life than I do, more about how I feel than I do, more about how I will feel in 5, 10, or even 20 years from now than I do, is very arrogant, ignorant, and insulting to me as a person who has been dealing with the same issue since I was 13 and started having irregular, painful, heavy, and unpredictable periods that progressively got worse as I got older. Some recent symptoms that I've been experiencing that have gotten worse over the last several months include, but are not limited to, the following: extreme fatigue, hair thinning and hair loss, extreme random abdominal pain and cramps, increased urination and urgency, that includes sudden intense urges to pee, feeling like I'll wet my pants if I don't pee right then, pain if I don't pee, waking up in the middle of the night to pee, pain in my pelvic area when I have a normal bowel movement, loss of appetite, and hot flashes. I have also had these frequent instances where it feels like my uterus is shivering, like slight vibrations where my uterus is on the inside. I had my last surgery in January, had a period in February, then didn't have one again until the end of June, when I had one of the worst periods I've ever had, and I haven't had a period since then. I am very weary of dealing with all of these symptoms and the intense pain, and yes, every woman will say, I'm tired of my period, I wish I didn't have it, but for me, it's literally debilitating. I am bedridden for the first 2 days at least of my period. I have to wear 2 pads, otherwise I bleed through my underwear and pants and onto my bed. Not only is that frustrating to have to wipe up all of the blood, but it also isn't good for my blood sugar. I have to eat every 3 hours normally, or I feel faint. when I'm on my period, I feel faint a lot quicker and have to eat immediately after waking up in the mornings, or I feel like I'm going to pass out. I have to use my electric blanket as a heating pad for my entire abdomen, sweating because of how hot it is, but it helps the pain. I have to take prescription strength Tylenol because any anti-inflammatory upsets my sensitive stomach. There are also random days throughout the month that I'm bedridden due to the random intense abdominal pain that comes with endometrial tissue floating around in my body where it shouldn't be. I can't go anywhere or plan anything because I never know when I will have these intense pains or when I will just not feel good overall. My body feels so sick and weak and tired all of the time, partly because of being on that shot and experiencing menopause without being able to seek relief with hormone replacement, but also because I am literally bleeding internally. Imagine bleeding internally every month and having a doctor tell you that it's normal, it happens, it's something you just have to deal with, and that he won't do surgery to fix it, because what if you change your mind? You don't know what you want, you're not old enough to know what you want. When I tell people about everything I just explained, their reaction is immediate shock and empathy, and they don't understand why I am refused the surgery either. In fact, I created a petition to show you exactly how many people agree with everything I just said. I posted it just over 36 hours ago, now 48 hours. And I already have 81 signatures, including people from the UK, Germany, Italy, Canada, even South Africa. There have been numerous comments further stating their support, saying the following. And then I have all of these comments that people left on the petition that I printed out and gave to him, like I said. I am also in regular counseling, and my counselor agrees that this is the best choice for me and is willing to have us cover the topic in more in-depth counseling if that's what it takes. And this is the part where I started crying. In conclusion, I am tired and frustrated and desperately want someone to hear me and listen to me because I am in so much pain and discomfort all the time, and I just want to live a normal life. So after all of that, first of all, I went in and he started, of course, giving me the whole, that's a permanent procedure and you're really young and it's a drastic thing and blah, blah, blah. So then I said, I printed out what I wanted to say beforehand to make sure that I included how I felt and everything. Would you let me say all of this without interruption? So he agreed. And I made it through the entire 3-page speech, I guess you could call it. And then started crying during the conclusion, like I said, because I just felt so defeated, tired of no one ever listening. However, this doctor did listen, and while he hasn't scheduled my surgery yet, he did agree to consider it under the following circumstances. I have to have a psychiatric evaluation that results in a letter from the psychiatrist stating that I am in sound mind and am capable of making this decision on my own. And if that happens, he wants me to go back on the birth control shot, which is called Lupron, the Lupron injection, which put me in early menopause. He wants me to go back on that, but this time he is going to give me hormone replacement therapy at the same time to counteract the symptoms of menopause. He said he didn't know why my other doctor said I couldn't do that. He said that the shot along with the therapy would mimic a hysterectomy, so that would give him a clearer picture, and it would confirm to him that the surgery would help me, because he said, my goal is to help you feel better, and if that means having a hysterectomy after all of this, that he would be willing to do that, as long as I got the letter and went through the 6 months of being on the injection and hormone therapy. So he said that he would not start me on the injection until I got the letter from my psychiatrist, so that I wouldn't be going through any unnecessary treatment and pain. So I called my psychiatrist and made an appointment, but they didn't have anything until September 6th, so I asked them to put me on the cancellation list and took that appointment. But hopefully I can get in sooner, because this is a 6-month process, like I said, so I'd like to start it as soon as possible. He said that he would check in on the 3-month mark, and if I'm feeling drastically better, that he would be willing to do the surgery. Basically, what he said is that he would be willing to do the surgery before the 6-month injection wears off. So he would not make me come out of menopause, I guess, again, like I'm going through right now. And if all goes well, if I get the letter, if I get the Lupron injection and the hormone therapy and I feel drastically better, then he will have confirmed that the hysterectomy would be the right choice for me and that he would be willing to do it after all of that. So I felt very overwhelmed after the appointment and after he said all of those things, because on the one hand, I'm terrified to go back on the shot because I don't want to feel like crap all of the time like I did last year. I cannot explain how awful that was for me, and like it was one of the worst, it was the worst several months probably of my entire life, and I'm scared that that's going to happen again, but I'm hopeful because the hormone replacement therapy is supposed to work and counteract the symptoms of menopause. So if they work and it goes well, then I'm very, very grateful and excited that he would be willing to do that surgery, because while this appointment was not a total victory because he hasn't scheduled anything yet, it is a small victory in that he even considered it an option when the 2 doctors before him flat out told me that they would not do it. He seemed like a very reasonable person, and he listened to me and agreed that I should have the right to decide what I want to do with my own body. And he didn't even bring up the child aspect of it. He wasn't even concerned about that because he told me he has adopted a child as well, and so he knows that there are other options than just regular childbirth, and that was very encouraging for me to hear from him. So while I was overwhelmed after the appointment, because first of all it was very intimidating, and I was very, very nervous and scared to talk to him, saying all of what I just said, because I even practiced on my parents beforehand, but when you're sitting there in an exam room and this appointment seemingly determines the quality of your life, it's a huge, huge deal, and it was terrifying. I didn't know if he was going to steamroll me and not let me talk. I didn't know if he was going to, after everything that I said, I didn't know if he was going to ignore it and just say no. He started out by saying that normally I would want to know the person for years and go through even more laparoscopic surgeries, and you know, there are women who have been through much worse than you, and I said, I understand that. I know I'm not the worst case scenario. However, that does not mean that the pain that I'm going through is not valid, and it does not mean that I don't deserve to live a normal life. So, all of that being said, I wanted to thank everyone again for signing and sharing and watching and encouraging me to stand up for myself and make sure that I am heard as a human being who deserves the right to medical care if that care is what's best for me. I will continue to update you guys. I will do logs of how I'm feeling while I'm on the Lupron injection if you want to subscribe for those. And I think that's everything. So I'm sorry if this video was super long. I'll try and cut out any pauses that I might have, or like where I stumbled on my words and had to re-say something. But I really hope you enjoyed this video, and again, thank you so very much for your support and love. I cannot tell you how much it means to me. And I will see you in my next video.